Welcome to our YouTube channel. We hope that our efforts based on science and over 15 years of clinical experience regarding tinnitus and its associated problems will provide you with solid knowledge to help you better understand the nature of this condition. We are going to talk about a very important topic which comes up on many occasions during our conversations with tinnitus sufferers during the tinnitus assessment procedure. How can bothersome and persistent tinnitus be reduced and eventually eliminated with a proper treatment? Many people with Category 4 tinnitus may find it challenging to envision life without the persistent noise and other associated symptoms. But in truth, this is what a proper tinnitus treatment is designed for. As you can see on the screen, a severe level of tinnitus, as indicated by the Tinnitus Handicap Inventory Scale score, can cause so many problems that normal life slips away, being replaced by the constant nightmare of fear and annoyance. And that's not even considering the anxiety or panic attacks, sometimes caused by sudden changes in the tinnitus noise, such as pitch or loudness. Why do many tinnitus sufferers and their helpers remain unaware of the concept and benefits of tinnitus retraining therapy? Definitely, there should be more clarity when discussing tinnitus retraining therapy (TRT) and cognitive behavioral therapy (CBT). Unfortunately, there are many hearing clinics out there claiming to use TRT therapy. Yet there is a fundamental difference between what masking or so-called TRT is known for and what should be expected from professional TRT and CBT programs that follow the best and research-proven protocols. Why you should never mask your tinnitus. As you know by now, it's been more than 15 years since we started working with tinnitus patients as clinicians, so we have gained a significant amount of experience in this field. As a result, we have seen thousands of patients in our clinic who come to us for help and hope. Please understand that the individuals we work with typically do not exhibit low levels of tinnitus symptoms that have not yet caused severe problems. In fact, majority of our patients come to us with severe or even disabling tinnitus symptoms, which significantly impact their quality of life. We are talking about those who can't get relief by touching their heads or performing other internet-suggested actions. Yet we are most concerned about those who rely on masking to manage their symptoms, whether for a short or extended period. So to all of these people, we have one important message. Whatever you do, don't try to mask your tinnitus. Masking will only make your conditions worse. Now let us tell you why. For many years, it has been widely accepted that tinnitus occurs in your head, and not in your ears or as a result of a problem with your neck, head, or anything else. But a variety of factors can cause tinnitus, and there is one thing that is guaranteed. When tinnitus begins, nothing can be done to stop it, regardless of whether the main cause is there or not. Simply put, it's like using a device with a push button but no corresponding stop button. Yes, some people who have had tinnitus for a long time can become habituated to the presence of tinnitus noise. The tinnitus that these individuals experience is constantly present and can reoccur at any time if certain triggering conditions are present. But let us go back to masking. Here the explanation is relatively straightforward. Simply put, your brain delivers tinnitus on purpose to your conscience. What will your brain do if you prevent it from being able to deliver tinnitus? It will try even harder. You see, when you're exposed to a sound as loud as tinnitus, or even louder, your brain starts competing with it and may end up increasing the loudness of your tinnitus. What's more, if you have a decreased sound tolerance, which is often the case with tinnitus at a severe or catastrophic level, exposure to sound will negatively influence the tinnitus loudness and annoyance as measured by the Tinnitus Handicap Inventory Scale. Why Tinnitus Handicap Inventory Scale must be used? What is it and why is it so important? For quite a long time now, clinicians who work with many tinnitus sufferers, practically in every professional tinnitus clinic worldwide, have been discussing the need for a reliable and accurate method of assessing tinnitus severity. Researchers have been thinking about the pitch or nature of the tinnitus sound for a while now. As a result, many videos on the internet have been created to help tinnitus sufferers determine their tinnitus frequency. There are many videos containing masking sounds at some frequencies intended to provide tinnitus sufferers with some means of temporary relief just by listening to them. Research findings and countless white papers on the internet confirm the negative effects of masking for extended periods of time. And we, as well as many clinicians working with tinnitus patients, strongly recommend staying away and being very careful when using masking as a way to experience temporary relief from tinnitus noise. Please watch one of our future videos which will specifically explain why and what is involved in prolonging exposure to sounds used typically for a masking purpose. The second part of what tinnitus testing used to be is to determine the loudness of tinnitus sound. The main problem and what makes this approach useless is the unique nature of tinnitus itself. Some tinnitus sufferers experience a consistent sound that does not vary in pitch or loudness. This is typically observed in cases of long-term tinnitus, or where individuals may have been dealing with this condition for over 20 years. Sometimes they experience the same sound, which they somehow have gotten used to over time. In fact, they may get to the point where this tinnitus noise does not affect their lives as much. However, on many occasions, they seek our professional help when their tinnitus changes and suddenly becomes so annoying that they are looking for help. There is another crucial part of this dilemma clinicians are facing, and this is a well-known unique characteristic of most tinnitus symptoms people experience. What is it, you may ask? Well, it's a seemingly simple thing. You see, tinnitus can fluctuate multiple times throughout the day and night. It can change loudness, going from low to extremely intense sound. In addition, tinnitus noise can often change its nature or pitch, which may be annoying and cause more anxiety. This is why measuring pitch and tinnitus loudness is not necessarily the best way to learn about the true nature of tinnitus. To make it worse, this type of measurement does not tell us anything about all other tinnitus symptoms, which are often quite extensive and annoying and affecting many aspects of the tinnitus sufferer's life. There are better ways to learn about what they experience than asking people what their tinnitus is like, and asking family members is also not helping much. So what would be the best way to learn how severe this condition is and its effects on the tinnitus sufferer's life? We are talking about tinnitus handicap inventory. Research has proven this method, and it is widely used to provide an accurate picture of tinnitus. It is known as the only proper method of giving a precise assessment and recognizing the severity of the tinnitus sufferer's condition. According to the American Tinnitus Association, this questionnaire aims to identify and evaluate the difficulties that you may be experiencing because of tinnitus. Results are presented in numbers to identify the severity of this condition. The score goes from 0 to 16. It represents slight tinnitus. Then, scale from 16 to 36 is a mild handicap. Next, 38 to 56 show moderate tinnitus level. And 58 to 76 confirm the presence of what is called severe tinnitus handicap. And eventually, a 78 to 100 score is a reflection of the catastrophic level of tinnitus. The Tinnitus Handicap Inventory Questionnaire is just one of the tools used in the proper tinnitus assessment. After tinnitus assessment, the sufferer should request information about their level of tinnitus. This is also confirmation of having one of the parts of the proper tinnitus assessment procedure performed. Our upcoming videos will provide information about the various levels of tinnitus handicap. Make sure to hit the subscribe button to stay up to date and be notified when new videos are posted. By subscribing, you also help us continue to create high-quality, informative videos for you. You may ask yourself, how should I know what a proper tinnitus assessment is like? Well, it is a crucial question to ask, because a proper tinnitus assessment can profoundly affect your well-being, and only by following the right assessment you can expect changes in tinnitus. There are many different tinnitus conditions. They differentiate based on whether tinnitus is caused by itself or being in the company of other problems such as very high levels of anxiety, decreased sound tolerance, hyperacusis or recruitment, and others. In reality, we rarely deal with tinnitus on its own. Most tinnitus sufferers often report other health issues or conditions that have been present for an extended period, which in effect are caused or connected to the onset of tinnitus. Now let's take a close look at the detailed picture on the screen. As you can see, tinnitus is not a singular condition affecting everyone in the same way, but instead there are many different types of tinnitus conditions, each with unique symptoms and characteristics. And that's precisely why no single remedy would work for all tinnitus sufferers. For that reason, tinnitus management, which includes therapy and treatment, is always highly personalized to address tinnitus sufferer needs. A proper tinnitus assessment differs so much from what people seem to think about it. In fact, the tinnitus assessment and the hearing test performed to write a hearing aid prescription are two completely different procedures. For example, we often see tinnitus sufferers telling us about having a tinnitus assessment done, but in reality, they are referring to the standard hearing test. People are usually quite surprised to learn how unique tinnitus assessment is and how much it differs from standard testing because it includes procedures that are not performed in hearing tests. These differences in testing methods simply reflect the purpose of the tinnitus assessment. As we expand our knowledge about the true nature of tinnitus, we also need to make sure that the tinnitus sufferers receive the right help. Therefore, during the proper assessment, we must ensure that we have a complete understanding of what's happening. We need to determine the cause of the tinnitus of this specific patient, and we also need to confirm that the family physician has seen our patient and that the ear, nose, and throat specialist has been involved in investigating the cause of their tinnitus. While in some cases a thorough psychological evaluation may be needed, but there are some specific tests that must always be performed, and that's because test results are critical in deciding the right course of action for the proper management, therapy, or treatment process. We invite you to explore our YouTube channel and view our other videos, including one that provides information about the tinnitus handicap inventory scale. And make sure to subscribe to our channel to stay informed about our upcoming videos. We work with thousands of tinnitus patients and feel obligated to share our knowledge and experience. As you know by now, our channel is for people like you, searching for answers to their tinnitus questions. Let's start at the beginning and talk about hearing loss and tinnitus to clarify any confusion because it is important to understand the basics. I have tinnitus. Does it mean I have hearing loss? Tinnitus and hearing loss do not necessarily occur together. Many people complain about tinnitus without having a hearing loss. In fact, some symptoms of tinnitus, like hearing loss, can be actually treated. Let's start at the beginning and talk about hearing loss and tinnitus to clarify any confusion because it is important to understand the basics. There are two major types of hearing loss. The most common is called sensorineural hearing loss. This hearing loss is the most common because it affects almost all of us at some point. And it is showing in our life usually when we are getting to be a bit older, or for example as an effect or prolonged exposure to loud noise, or caused by medical problems or side effects of some medications. It could be connected to a traumatic brain or head injury, and sometimes has a genetic background. But the most common causes are noise and aging. Please take a good look at the picture. It shows an inside view of cochlea where we should have around 15,000 hair cells. These hair cells shake as the sound wave runs through the liquid inside the cochlea. Some nerves attached to the cells generate nerve impulses due to the hair cells activation. Those small electrical currents are transferred to the brain's central processing centers. And this, in simple terms, is the most basic explanation when discussing the most common type of hearing loss. The second type of hearing loss is conductive hearing loss. Again, to make it as simple as possible, in this kind of hearing loss, there are issues in the middle ear that prevent sound waves from reaching the inner ear. Now, what is the tinnitus place in all this? You may want to watch some of our videos to refresh your knowledge. Tinnitus is caused by abnormal electrical activity in parts of the brain, and it can be actually seen by using what is called functional MRI. Please watch our tinnitus curse or blessing video, which shows how tinnitus looks like. So, what is tinnitus doing to our brains? First of all, it makes them tired. Tinnitus is nothing else but abnormally high levels of activity in the same parts of the brain. This is also why there is no cure for tinnitus. The only way to successfully remove tinnitus from our life is to remove the connection between tinnitus as a process and our awareness. In certain types of tinnitus, there are some ways of getting temporary relief, and this is something you can find on the internet where many people are, for example, showing different tricks based on adjustments of the necks or jaws. Also, masking, or in other words, listening to sound louder than tinnitus intensity, can make the tinnitus disappear for some time. Unfortunately, it does come back most of the time, and it's even louder. Meanwhile, this abnormal brain activity constantly shifts its location, occurring predominantly between individuals' nerve cells. And this is why there is no cure. Sometimes antidepressants are prescribed to help people who have extremely loud and annoying tinnitus. They are known to affect some parts of the human brain by making them less active than they normally would be, but most are known to be addictive and may cause side effects. Now, going back to our brain, most of the tinnitus-related problems we experience are based on our brain not being able to work correctly because some parts of our brain experience abnormally high levels of activity, making the brain to be so busy that it is not able to continue to do what it should do. This is the situation when people are having problems that sometimes greatly diminish their ability to focus. For example, staying focused to do some work can be quite difficult for them, especially for a longer time. Many individuals, even those with a very low presence of tinnitus, often complain about experiencing short-term memory difficulties when discussing loudness or annoyance. Again, the easiest way to think about this problem is this lack of spare brain processing power, and the brain of the tinnitus sufferer is so busy with this abnormal activity caused by the tinnitus presence that in effect some other brain functions are not as well taken care of as they should be. The exact cause of the rapid increase in electrical activity in our brain in this fast-changing pace is still mostly unknown. There are some theories and hypotheses, but the best science has to offer is this understanding that some parts of the auditory system are somehow connected to this process. Does this mean a hearing loss must be present to cause this activity somehow? Absolutely not. A lot of people say they have tinnitus, but their hearing is fine and their hearing tests come back normal with no issues. Still, a standard hearing test is helpful to check the patient for hearing loss presence. It doesn't include a lot of other important tests that can show what's going on and how the auditory system functions. So the idea is that some distortion might occur somewhere in the auditory system, which could be one of the preconditions of tinnitus. However, except for scientific studies and professionals in the field, most people won't actively search for the presence of these distortions. Please listen carefully. Scientifically verified and proven on countless occasions knowledge indicates that more than 20% of chronic tinnitus patients have no hearing loss present. More than this, the presence of tinnitus does not indicate an imminent or future onset of hearing loss. So here we are, and honestly, in our clinic, we have seen more people not having hearing loss and complaining about tinnitus than people with hearing loss and tinnitus. But in the case of hearing loss and tinnitus presence, we see most of those people complaining about experiencing problems with the loudness of sounds. In the case of younger people, we usually see a hyperacusis presence. Again, please subscribe to our channel as one of the videos just to be released is about tinnitus and decreased tolerance for loud sounds, or even worse, high-pitched sounds, like cleaning the dishes. But going back to tinnitus and hearing loss. As we say all the time, tinnitus has many faces, and it is absolutely a must part of the tinnitus investigation to do a proper hearing test, including the most important tests, which are, for different reasons, usually not included in most hearing clinic test batteries. So all tinnitus sufferers should ask for are an uncomfortable listening level UCL and LDL tests. Once again, I highly recommend watching our video on proper testing procedures and tinnitus assessment. It can truly make a difference in getting rid of your tinnitus by providing you with the right instructions and understanding the nature and type of your tinnitus. This knowledge can improve your quality of life while living with tinnitus. Always ask your audiologist about your test results. Understanding them and using this knowledge can make a huge difference in your life and how you can help yourself with tinnitus. There are many different tinnitus conditions. They differentiate based on whether tinnitus is caused by itself or being in the company of other problems such as very high levels of anxiety, decreased sound tolerance, hyperacusis or recruitment, hearing loss, and many others. In reality, we rarely deal with tinnitus on its own. Most tinnitus sufferers often report other health issues or conditions that have been present for an extended period, which are caused or connected to the onset of tinnitus. Don't forget and click subscribe. Who knows? This video by itself could change your life. And there will be more videos on topics you may find useful. So please, click that subscribe button now to receive our weekly videos and make the most of the valuable information they provide. There are many different tinnitus conditions. They differentiate based on whether tinnitus is caused by itself or being in the company of other problems such as very high levels of anxiety, decreased sound tolerance, hyperacusis or recruitment, hearing loss, and many others. In reality, we rarely deal with tinnitus on its own. Most tinnitus sufferers often report other health issues or conditions that have been present for an extended period, which are caused or connected to the onset of tinnitus. One of the most often discussed factors is tinnitus caused by a so-called whiplash, or it can result from various head or neck injuries, often caused in motor vehicle accidents. This type of tinnitus is often portrayed as having a quick and easy solution for instant relief. However, it's important to note that one of the major factors behind the onset of tinnitus is what we call traumatic brain injury, TBI. Please take a look at the screen and you'll see some typical side effects or symptoms caused by traumatic brain injury. In the case of this type of tinnitus, it is possible to experience instant relief at times, but very rarely this relief can become permanent and cause the end of tinnitus. Also, we must remember that TBI can and usually does cause many side effects and conditions that can make life highly challenging to sufferers for a long time. This is why it is strongly recommended that all people who have experienced traumatic brain injury pay attention to any symptoms that may indicate worsening problems over time. What is also typical to all TBI sufferers is decreased sound tolerance and sometimes hearing loss, which is directly caused by the accident. There are two major types of hearing loss. The most common is called sensorineural hearing loss. This hearing loss is the most common because it affects almost all of us at some point. And it is showing in our life usually when we are getting to be a bit older, or for example as an effect or prolonged exposure to loud noise, or caused by medical problems or side effects of some medications. It could be connected to a traumatic brain or head injury and sometimes has a genetic background. but the most common causes are noise and aging. Please take a good look at the picture. It shows an inside view of cochlea where we should have around 15,000 hair cells. These hair cells shake as the sound wave runs through the liquid inside the cochlea. Some nerves attached to the cells generate nerve impulses due to the hair cells' activation. Those small electrical currents are transferred to the brain's central processing centers. And this, in simple terms, is the most basic explanation when discussing the most common type of hearing loss. The second type of hearing loss is conductive hearing loss. Again, to make it as simple as possible, in this kind of hearing loss, there are issues in the middle ear that prevent sound waves from reaching the inner ear. Tinnitus can also be caused by TMJ dysfunction, TMD. This condition leads to pain and tenderness in the jaw joints and the muscles and ligaments around them. There are various causes of TMJ, including teeth grinding, jaw injuries, arthritis, and everyday wear and tear. Treatment for TMJ varies from person to person and may involve medication, physical therapy, custom mouth guards, or jaw surgery. TMJ can cause tinnitus symptoms, although the severity differs, and it usually doesn't worsen over time. While medical intervention can effectively address most TMJ symptoms, tinnitus may remain a separate condition in some cases. The nature of tinnitus. We have chronic tinnitus, which persists for an extended period, and there's temporary tinnitus, which comes and goes on its own. Let's explore these two types further. To our best knowledge, one of the most important factors that comes into play is the cause of tinnitus onset. Multiple major factors can trigger chronic tinnitus. One of the most common causes that often shows up is high anxiety and prolonged stress. According to Professor Pavel Yastrebov's tinnitus condition model, the limbic system plays a significant role in chronic tinnitus. In fact, even temporary tinnitus is greatly influenced by the activation level of the limbic system. Tinnitus, anxiety, nervous breakdown, break the cycle, change your life. Are you constantly busy with work, running a business, or holding a high-level management position? Do you know that tinnitus might be a sign that we are pushing ourselves too hard and fast? If this is you, you must watch this video. It may change or even save your life. The persistent presence of chronic tinnitus at a certain level can significantly impact the performance of busy professionals and their cognitive abilities. To all professionals who have discovered tinnitus, and especially are dealing with chronic tinnitus presence, we have just one piece of advice. Do seek out effective therapies or treatments to help mitigate tinnitus's impact on your professional work. Some videos on our channel tell you what and how you should approach this problem. In this video, we will discuss why taking care of chronic tinnitus as quickly as possible is especially important for all successful and busy professionals with many responsibilities who often hold upper-level management or executive-level positions. In addition to their daily workload and job responsibilities, these individuals have family commitments and other obligations. Indeed, we are focusing on people for whom stress has nearly become a way of life. Regrettably, a significant proportion of them might eventually face a nervous breakdown, feelings of burnout, symptoms of clinical depression, emotional collapse, or even cracks in their overall well-being. Keep an eye out for signs that indicate heightened levels of chronic stress and anxiety, which could lead to a potential nervous breakdown and even the onset of depression, all in conjunction with the presence of tinnitus. These warning signals include low self-esteem, fearfulness, irritability and nervousness, excessive worrying, helplessness and loss of control, anger issues, social withdrawal, loss of interest, anxiety and panic attacks, unexplained sadness, dangerous thoughts, like entertaining thoughts of self-harm or even suicide. These are all potential signs that the combination of chronic tinnitus and ongoing stress might be taking a toll on mental and emotional well-being. The concept, as we are all well aware of, and as demonstrated in our videos, is supported by substantial evidence. Tinnitus is often observed to follow or coincide with periods of heightened stress. As you can see on the screen, the research findings confirm and tell us that in 75% of chronic tinnitus cases, the onset can be connected to high stress and anxiety levels. Also, more and more studies indicate a clear connection between tinnitus presence and cognitive abilities. This connection is much more visible when elevated levels of stress and anxiety caused by tinnitus are present, in addition to work-related stress and anxiety. To clarify, we are specifically addressing chronic tinnitus. This form of tinnitus generates noise that disrupts various aspects such as sleep quality, leading to difficulty maintaining focus and sustained concentration. It's essential to understand that we are not discussing a temporary form of tinnitus that has minimal impact on our cognitive and mental functions. Instead, we are dealing with a persistent and consistently present condition that significantly affects our awareness. This particular type of tinnitus is increasingly associated with a range of issues and sometimes even forces certain professionals to stop working altogether. Looking at the screen, you can see some severe tinnitus symptoms as measured by the tinnitus handicap scale known as the THI scale. However, the list of symptoms doesn't include two common elements known to be present in the vast majority of patients. These are high stress levels, or even anxiety, experienced by almost continuously by the sufferers, and decreased tolerance to sounds. Please remember that as human beings, we aren't inherently equipped to manage prolonged stress effectively. This is a situation which, over some time, will result in some severe symptoms, as you've heard a short while ago. If you notice more than 3 symptoms from our list, we strongly recommend seeking professional help, starting with talking to your family physician. Considering the added presence of tinnitus caused by anxiety or long-term stress, along with other contributing factors, we must do our best to address both concerns. It's worth noting that tinnitus is known for causing additional stress and anxiety levels, leading our situation to worsen rapidly. In order to understand why tinnitus can cause stress-related or anxiety-related problems, we should remind ourselves what tinnitus is really all about. So as we know, tinnitus is nothing else but abnormally high levels of activity in some parts of the brain. The main problem we have with the presence of tinnitus is a simple thing, and this is not only this abnormally high activity happening in some parts of the brain, but also the extremely quick shift in the locations of this activity. This behavior closely resembles a short circuit in an electrical control box, or a virus within the computer software that constantly changes its location and is almost impossible to trace. From our experience working with upper management, business owners, and individuals holding top positions within entire corporations, we have gained a wealth of experience in providing them with support through the right therapies and our expertise. With a team of highly qualified specialists, we are fully equipped to limit and eventually eliminate tinnitus symptoms and offer our patients the opportunity for a life free of stress. Our approach involves instructing them to manage challenges in their professional and personal lives. Not all clinics specializing in tinnitus therapy will have the personnel and professionals to work with this type of patient we are discussing. Still, we strongly recommend talking to the family physician to find a good psychologist or psychotherapist to supplement the TRT and CBT tinnitus therapy. Proper therapy or treatment program should have all the necessary elements, and they should provide the patient with a complete changeover process based on providing tinnitus sufferer with knowledge and abilities, allowing them to be much more efficient at work and much happier at home. With life coaching elements based on neuroscience and psychology, this program should be highly personalized and designed to broaden perspectives, teach patients all important life and work skills, and lead toward finding balance, happiness, and a sense of purpose. Tinnitus presence should be treated as a starting point, with the sound in the ears and all other symptoms of long-term stress and anxiety treated as a warning signs indicating a need for a change. Thank you for joining us for the next episode of our Tinnitus Expert Advice series. We consider ourselves tinnitus experts because you see, for more than 15 years, we have helped thousands of tinnitus sufferers with various types of tinnitus caused by different underlying problems or health issues. Did you know that even a slight tinnitus, as we call it using the Tinnitus Handicap Inventory Scale, can have a big impact on people's lives? It's true, tinnitus is changing the lives of almost everyone who has this condition. And guess what? It's not just the sufferers themselves who are affected. In fact, their family members and loved ones are often left amazed and scared by the extent of these changes. Because often their families and loved ones are unsure how to provide the necessary support and assistance to make them feel more comfortable. Don't forget to subscribe to our channel, give us a like if you appreciate what we do for all tinnitus sufferers, and send this video to all people you know who are desperately looking for help or lost hope. Don't hesitate to share it with your network and make a real difference in someone's life. We've been working tirelessly at our clinic, helping as many people as possible for years. But you know what? Many people in Canada and the US still don't have access to clinics like ours. And that's just not fair. It makes us feel obligated to spread out our expertise and knowledge. And our goal is to reach all those who are ready to transform their lives for the better, whether it's learning how to embrace life with tinnitus or finding ways to get some relief. So join us on this journey. It's time to take control and find the relief you deserve. This channel is for you. Our mission at Metro Hearing and Tinnitus Treatment Clinic is simple: to improve lives. We are committed to doing everything we can to help you find relief and reclaim your quality of life. No matter how big or small the steps, we are here to support you every step of the way. It doesn't matter where you are or what your tinnitus is like. Let's go back to our discussion of tinnitus, shall we? Like we always say, tinnitus has different phases, and there are various factors that can trigger its onset. But here is the deal. There are some common preconditions that usually play a role, with a few exceptions, of course. We're talking about things like exposure to extremely loud noises, think jackhammers, shooting ranges, or crazy loud music concerts, certain medication side effects, or even incidents like whiplash or TBI. Now, here's where things get interesting. Scientific research has shown that the most typical preconditions for tinnitus are closely tied to sky-high anxiety levels and long-term stress. And get this, 75% of cases worldwide are linked to these emotional factors. There are patients of ours who keep on insisting that they do not have any emotional problems. Well, unfortunately, that may not be entirely true. Emotional factors can sneak up on anyone, and they might not even realize it. Research shows that the connection between tinnitus and emotions runs deep. As you know, we specialize in neuroscience at Metro Hearing and Tinnitus Treatment Clinic. And guess what? There is a lot of psychology tied up in everything we do. So here I am, ready to challenge all those who do not see the connection between tinnitus and their emotional well-being. And I will share something you might not be aware of. That long-term stress is not something to be taken lightly, because every stressful situation we encounter in our lives leaves a little something behind in our subconscious. It's like carrying around a weight on our shoulders that keeps getting heavier and heavier. Meanwhile, things may appear okay on the surface. Family, income, work, house, a new car should make us happy, right? But let's get real for a sec. If everything in life is so great, why do some people have trouble sleeping at night? What's the deal with that strange sensation of something trembling inside their chests? How about their legs constantly shaking and their hands moving as if controlled by a hidden remote? My friends, the answer is anxiety. It affects nearly 31% of the US population. Crazy, right? Now let's go back to what we promised to discuss in this video. Tinnitus is not just annoying noise in our ears. This condition has a very negative effect as it changes our personality right before our eyes. You see, tinnitus messes with our subconscious mind, affecting our thoughts and emotions. Remember, tinnitus is really nothing else but abnormally high levels of activity in some parts of our brain, and it makes our poor brains and minds overworked, exhausted, and as negative as possible, and it does show. We are losing patience and tolerance, and our nervousness makes people feel uneasy around us. Even our friends may slowly start fearing they might say or do something to set us off. We are so exhausted, desperately yearning for just a tiny break from this never ending nightmare. And of course, our loved ones are impacted the most. Unpleasant words slip out more often than we'd like to admit. We tell people to get lost or give us some space over and over again. Now, here's something important to keep in mind. As tinnitus sufferers, we are not oblivious to the fact that something is going on. We can sense those slow changes happening within us. But the pain can reach such extreme levels that we do start to lose care. All those arguments and disagreements that happen without a real reason, it's like a never ending cycle of tension. What's truly heartbreaking is how this condition widens the space between people who used to be so close. It's important to remember, though, that this condition is not just about noise. Tinnitus is actually changing our brains and our minds. This is not something people can simply fix themselves. Tinnitus has the power to transform us into someone almost unrecognizable. It's like we've become strangers in our own skin. That's why tinnitus sufferers desperately need support from family members, significant others, friends, and even coworkers. They are going through a tough time, and it's crucial for people around them to keep that in mind, that it's not their fault. This condition messes with their brains, bringing out the worst in them. But deep down, they are still the same wonderful people loved by us. So it's our job to be there for them, no matter what it takes. We should get involved and help them research information and seek professional help. Let's encourage them to take action and explore all available options. We can provide the support they desperately need and help them stay hopeful in the face of this terrible condition. So let's do this the right way. Get informed and seek professional assessments. The internet is full of reliable information. But most importantly, search for professional clinics that have experience working with tinnitus sufferers for years. They are the best source of information, and let's remember that a professional tinnitus assessment can take away a lot of anxiety caused by and connected to this condition. We're like mirrors reflecting the people who matter to us and striving to be the best versions of ourselves for them. Psychology's most fundamental concept is that if you want those close to you to be happy, you must find happiness within yourself first. It's the key to making others happy. It is not easy to make tinnitus sufferers happy, but we have to do everything in our power to make their lives as comfortable as possible. We need to understand what this condition is really doing to them and show them that we are here to support them every step of the way. More and more older people are starting to consider their future and what factors would significantly impact their quality of life and well being as compared to younger individuals. Tinnitus symptoms and the associated hearing loss often contribute to these fears, bringing additional set of issues to consider. As always, you can count on us to provide advice backed by our knowledge, the latest scientific research, and our extensive hands on experience gained from working with older individuals for over 25 years. So, what is the single most important thing we all need in our lives? Let's face it, it is independence and being in charge of our own lives. These factors are crucial when discussing our future and what truly matters. Personal independence is straightforward. It refers to the ability to be self reliant and take the necessary actions to create a fulfilling life for oneself and one's family. But how can we simplify this concept? Well, when we often discuss good health, the most important aspect of it is none other than the sharpness and efficiency of our brain. When we consider the role of our brain and our independence, it's easier to understand what it all means. Basically, as long as we can understand and comprehend what is happening to us, what matters at any given time, and what we should be concerned about, and how other people perceive and talk about us, we keep control over our own lives. In return, this active decision making process empowers us to manage our own affairs. And this is exactly what it means to be truly independent in 2023. And really, based on our extensive experience of seeing thousands of people every year, we can confidently say that what truly counts is the ability to remain in one's own home for as long as possible, enjoying all the joys life has to offer while keeping an active lifestyle for as long as it's possible. This is exactly why the state of our brain is a lot more important than our physical health itself. So, when should we take action to ensure our brain remains sharp for years to come? The answer is simple. Right now, regardless of our current age, the choices and actions we make at this moment will impact our future. We can guarantee this without a doubt because neuroscience mainly focuses on studying the brain and how it influences our behavior and cognitive functions. So, what is tinnitus doing to our brains? First of all, it makes them tired. Tinnitus is nothing else but abnormally high levels of activity in the same parts of the brain. This is also why there is no cure for tinnitus. The only way to successfully remove tinnitus from our life is to remove the connection between tinnitus as a process and our awareness. In certain types of tinnitus, there are some ways of getting temporary relief. And this is something you can find on the internet where many people are, for example, showing different tricks based on adjustments of the necks or jaws. Also, masking, or in other words, listening to sound louder than tinnitus intensity, can make the tinnitus disappear for some time. Unfortunately, it does come back most of the time, and it's even louder. Meanwhile, this abnormal brain activity constantly shifts its location, occurring predominantly between individuals' nerve cells. And this is why there is no cure. Sometimes antidepressants are prescribed to help people who have extremely loud and annoying tinnitus. They are known to affect some parts of the human brain by making them less active than they normally would be, but most are known to be addictive and may cause side effects. Now, going back to our brain, most of the tinnitus related problems we experience are based on our brain not being able to work correctly because some parts of our brain experience abnormally high levels of activity, making the brain to be so busy that it is not able to continue to do what it should do. This is a situation when people are having problems that sometimes greatly diminish their ability to focus. For example, staying focused to do some work can be quite difficult for them, especially for a longer time. Again, the easiest way to think about this problem is this lack of spare brain processing power, and the brain of the tinnitus sufferer is so busy with this abnormal activity caused by the tinnitus presence that in effect some other brain functions are not as well taken care of as they should be. One of the common complaints among tinnitus sufferers is about increased brain activity. This often leads to feeling much older, with our enthusiasm for life greatly diminished or even entirely gone. The reality is that tinnitus sufferers deal with constant fatigue resulting from ongoing abnormal brain activity that persists day and night, 24 hours a day. Anxiety, short fuses, and nervousness are reflections of this constant and increasing tiredness. Another problem connected to it is insomnia or problems with the quality or ability to sleep. The truth is, we can only sleep well if we are relaxed. There is no chance for a person with all those thoughts running like rabbits inside their head to enjoy a good and restful sleep. Discussing brain functions related to tinnitus is an activity which can take hours and hours. Connecting the rest of our body to tinnitus through the autonomic nervous system is another story which can also take hours of discussions. What we are going to do instead is to make some videos about very specific problems and connections between tinnitus presence and the brain. Personal independence is the most important value in our lives. It is getting to be even more important as we get older. Watch our future videos to learn how to ensure that the brain plays its role in our efforts to achieve true independence, which becomes increasingly important over time. Our brain is nothing more than a work in progress, and as long as we know how to take care of it, it can assist us in reducing or even eliminating the presence of tinnitus. Furthermore, it can remain sharp or even grow sharper throughout our lives. Why do many tinnitus sufferers and their helpers remain unaware of the concept and benefits of tinnitus retraining therapy? Definitely, there should be more clarity when discussing tinnitus retraining therapy (TRT) and cognitive behavioral therapy (CBT). Unfortunately, there are many hearing clinics out there claiming to use TRT therapy. Yet there is a fundamental difference between what masking or so-called TRT is known for and what should be expected from professional TRT and CBT programs that follow the best and research-proven protocols. It's important to recognize true TRT and CBT therapy's main goals, like the fact that they both aim to eliminate tinnitus during both day and night. They both do not just simply mask tinnitus with hearing aid noise or to offer only temporary relief during busy times. They both aim to provide genuine relief by reducing tinnitus awareness and annoyance. And they both aim to retrain the brain to stop paying attention to any remaining tinnitus in our minds. Tinnitus retraining therapy has been used to treat tinnitus for more than 3 decades now. But how does it do that? TRT effectively breaks the connections between the auditory, limbic, and autonomic nervous systems. It directly addresses both a decreased sound tolerance (DST) and tinnitus. You see, TRT is scientifically unique because it aims to work above the tinnitus source and at connections linking the auditory and other systems in the brain. So really at the end, the etiology of tinnitus is irrelevant. It's worth noting, too, that the significance of TRT stems from its proven effectiveness, which has been clinically demonstrated time and time again. In addition, many university clinics have verified that TRT can successfully treat all types of tinnitus and somatosounds. For example, when you search Medline's website for tinnitus retraining therapy, you will find over 100 publications. And according to most of these publications, TRT alone provides significant relief to more than 80% of patients. What's interesting, more than 1,500 randomized clinical trials demonstrating the effectiveness of TRT have been published in most medical and scientific publications worldwide. Yet, despite being universally accepted and proven to be the only successful tinnitus therapy, it still remains relatively unknown and underused in North America. Why this is happening is even more puzzling given that the medical and scientific communities in the United States and Canada also recommend this therapy. Yet the truth is quite simple. Regrettably, only some clinicians understand how to use TRT or even what it is. Our Metro Hearing and Tinnitus Treatment Clinic is one of the first clinics in Canada to use TRT successfully. In fact, for many years, we were the only clinic providing treatment based on tinnitus retraining therapy. This was possible because we had a strong educational background, including higher level education from the only university program where TRT was taught. Additionally, we also received hands-on training from working with the main TRT founder, Professor Pavel Yastrebov, in his clinic. Additionally, we have over 15 years of experience using the principles and all the small yet equally significant aspects of TRT therapy in our daily work with thousands of patients. And so the question is not so much about how successful tinnitus retraining therapy is, but actually about who is using it and how well this person understands it and how it should be used. There are no books or manuals about this therapy to explain every important detail. Every patient is unique, and the therapy, although based on the same principles, will be tailored to the individual needs. And if you have tinnitus and seek therapy, it's important to check whether you are receiving the TRT. Unfortunately, some people may be using the TRT name without actually giving the treatment, so you must ensure you're dealing with legit and qualified professionals who can provide authentic TRT therapy. Please remember that proper and authentic TRT consists of many hours of counseling and highly specialized and personalized sound therapy based strictly on the neurophysiological model of tinnitus. The main goal of retraining counseling is to reclassify tinnitus into the category of a neutral stimulus, while the primary purpose of long-term personalized sound therapy is to decrease the strength of tinnitus-related neuronal activity. Properly used, DRT makes a huge difference in a matter of months. More information about tinnitus retraining therapy is available in some of our videos. We hope that our efforts, based on science and over 15 years of clinical experience regarding tinnitus and its associated problems, will provide you with solid knowledge to help you better understand the nature of this condition. We are going to talk about a very important topic which comes up on many occasions during our conversations with tinnitus sufferers during the tinnitus assessment procedure. We are referring to the natural habituation process and problems connected to recurring tinnitus symptoms, sometimes reaching catastrophic levels. So, how does our brain compare to a computer in certain aspects of its functionality? For instance, we can identify specific regions of our brain that operate similarly to a random access memory chip called RAM because they are storing and retrieving information as needed. This part of the computer allows for the usage of practically all computer software loaded onto the computer's hard drive. The capacity of RAM is crucial to the overall computer's performance. Occasionally, if there is not enough space, it cannot work effectively, making it impossible to run certain software. This issue is very familiar to people who engage in computer gaming with high-resolution graphics or employ AutoCAD software commonly used in engineering. But it's important for us to note that comparing the brain and computers is a simplification, as the brain is a complex biological organ and computers are man-made machines. When it comes to computers, we have the option to upgrade the RAM or graphic card capacity, and in the case of human beings, unfortunately, there is not much we can do. The picture you're looking at now shows part of the human brain, which is designed to make us either aware of specific sensations or disregard them as insignificant without the need for conscious attention. This is one of many safety features in our brain that allow us to function. Due to the limited capacity of our human version of the random access memory chip, we are consciously aware of what truly matters to us in any given moment of our lives. This part of our brain works with all senses and even upper brain memory functions. This makes the habituation process a very important brain function because it allows us not to be aware of stimuli constantly present in our environment. This is why some people who have experienced tinnitus, even at a very intense level, can with time get used to the presence of tinnitus noise to the point that awareness of tinnitus is almost gone. As you know now after watching our videos, habituation is also included in the tinnitus treatment we are providing our patients within our clinic. Habituation and brain conditioning actually make tinnitus go away. The difference is that with habituation and brain conditioning, chances for tinnitus to return are minimal. Unfortunately, natural habituation doesn't work the same way, and in many cases, with some triggers present, tinnitus can come back at sometimes even catastrophic levels. Most people we are talking about are older people with certain personality types and a history of working in noise for many years. But younger people can experience this type of tinnitus setback as well. It is challenging to habituate tinnitus for the second time in a row. In the case of older people, they have recruitment and hearing loss present as well, and they usually experience a very high level of anxiety. As we have mentioned on multiple occasions, using conventional hearing aids, which are usually programmed to address hearing loss, can exacerbate tinnitus symptoms, leading some individuals to reject the use of amplification altogether. This situation by itself is creating so many problems for them and their family that it takes a team of professionals considerable time to be able to make a difference. In one of our future videos, we plan to discuss tinnitus setback prevention and we will talk about habituation again. In the meantime, please subscribe our channel to make sure you are going to be notified when our next video will be posted. Do you want to help yourself? We will talk about how tinnitus can get worse during the night. We will also discuss the noisy sounds used by tinnitus sufferers to get relief. Sometimes they help, but they can also make tinnitus even worse. We consider ourselves tinnitus experts because you see, for more than 15 years, we have helped thousands of tinnitus sufferers with various types of tinnitus caused by different underlying problems or health issues. So we've gained valuable insights and knowledge throughout all these years, and now in our new series of videos, we'd want to share them with you. To ensure you get all of our future videos, we encourage you to subscribe to our channel and leave comments on what topics you would like us to explore. Subscribing is quick, easy, and completely free. What are the advantages of using noisy sounds during nighttime? Please understand that exposure to sound is extremely important in most tinnitus therapies and specialized treatments, but what we will talk about is something much more straightforward than how noise is used in therapies. And let's keep in mind that noise exposure should never be used to mask or make tinnitus disappear. Instead, it should be used to introduce some activity within the auditory system. When your brain is busy and active, it has an effect on the tinnitus level and helps reduce tinnitus annoyance. So yes, we are talking about dividing brain attention between tinnitus presence and activity within the auditory system. The loudness of noise is used for this very purpose, to make your brain busy and active. Mind you, this noise distraction should always be settled very carefully so the noise exposure does not create additional problems. Understanding what happens at night in our brains and how it can help reduce tinnitus symptoms is very important. And in our future videos, we'll go into more detail about what happens in our brains from the onset of tinnitus and its effect on brain functions. This information can change your life, especially when managing tinnitus. So don't underestimate the impact it can have on your well-being. Let us focus now on the part of our brain that regulates our awareness and determines what is important and what is not at any given moment. Our brain thinks that tinnitus is important and feels driven to make noise and cause other symptoms that go along with it. Still, when some activities demand more attention, the brain does not have enough processing power to deliver tinnitus while also performing other tasks. When this happens, the brain may put these things ahead of tinnitus, making the tinnitus softer or even disappear for a while. But what happens when we are resting at night in bed? Well, not much really, and this is why tinnitus tends to amplify for worse, because not much is happening to change our brain's attention. As a result, tinnitus gets much worse, at least for most tinnitus sufferers, at nighttime. So, how can we help ourselves in this situation? One of the proven ways is to introduce some activity within our auditory system. You see, because our brain is connected to the auditory system, that's why providing it with something to engage with can be helpful. So feel free to use noise machines, pens, radio, TV, and phone applications to create background sounds. But be careful of the volume level. Pay attention to how loud the sound is. As we've discussed in our previous videos, it's important to know that you should never mask your tinnitus. We encourage you to watch this video again and review the content to ensure you'll gain maximum benefit from the information provided. Before you go ahead and search for our video on masking, please take a moment and subscribe to our channel. By subscribing, you'll stay up to date with the release of our upcoming tinnitus expert advice videos and receive timely notifications about their availability. It's a small effort that will keep you informed and connected to our valuable content.